I like to think of prodromal labor as like practice labor, right? So your uterus, it has to coordinate in order to like function. I think of prodromal labor as like the uterus kind of getting with the program, right? Like all the functioning muscles of the uterus getting with the program. We can offer like different comfort measures in prodromal labor. Sleep is like your best friend. Sometimes it's hard, but it's just like that's what you need right now. Take a deep breath, rest, get some sleep, stay nourished, stay hydrated. So back labor, you mainly have back labor when the fetus is not positioned optimally. It can be very intense for a lot of people, so we recommend like double hip squeezes for back labor. We recommend like maybe like even curb walking or lifting one leg and alternating that. And back labor mostly is baby's positioning. We try to do things like prenatally where we're just like, okay, check out spinning babies, or, do some cat-cows, offer the things, or it's just like, let's prevent this from happening. Sometimes with prolonged labor, it's this thing where you're like chasing labor. We don't necessarily want that because if it's labor, it's labor. Prolonged labor is not fun. Like you have a higher risk of like maternal exhaustion, just things not wanting to work the way they should. Here at the birthing center, like we want to give everyone a chance to labor as long as possible, but just when it's not right, right? So then there's that like informed decision making and that discussion that you have with the client or the patient. And sometimes they need pain relief. Sometimes they need fluids. And then those are like appropriate times and reasons to transfer. So it's like informed decision making is so important. Obviously, like trauma can't always be prevented, but I think that when you have a discussion about it and you have clear choices, that it helps. Like it helps you navigate these systems, especially if like you're a first-time mom. Precipitous birth is when, as a first-time mom, you deliver within 4 hours, and then as a multip who's had babies before, you deliver within 2 hours, 2 to 3 hours. Precipitous labor is a roller coaster. It's crazy. So a lot of people are like, we want a fast birth, and it's just like, okay, yeah, but maybe not, because it like hits you all at once. Like it feels like you can't get on top of it. And then sometimes it can cause like hemorrhaging postpartum or, lacerations. It can increase your risk of having a laceration. Sometimes those people require like fluids or, hemorrhagic, anti-hemorrhagic medications. But some precipitous births are okay and some are just like, that was crazy. Like, what was that?